Hi, my name is Wales Wong. I go by the pronouns for she and her. I am the chief steward for CUPE 3907, and I am in the CTL department and the LLE program. So today I'd like to talk a little bit about the factors that impact your mental and physical health in the workplace. And as you know, the workplace is quite a different concept nowadays, now that we've experienced how the pandemic has influenced our work lives. So I'll talk a little bit about psychosocial risk factors. What exactly are they? Well, they are workplace elements that can pose risks to workers' mental health and safety if it's not properly managed. The psychosocial part about it, focusing on psychosocial hazards, shifts the emphasis away from individuals and onto the workplace. So some of the things that we are going to talk about today is the organizational culture, the workload management that we have to address now, isolation and loneliness, and also ergonomics.
I'm going to talk a little bit about the organizational culture aspect. The organizational culture at a top school like U of T and a top faculty of education like OISE is undeniably intense, stressful, and competitive. We're constantly expected to overwork and overachieve just to survive financially and academically. However, students and graduate student workers are basically at the bottom of the food chain in the rigid hierarchies that structure the academy, including U of T and OISE. We're in a totally precarious position within these organizations. And so our health and safety is therefore also compromised and subject to leader knows best type management from high above. A good example of this is how health and safety issues are handled outside of the Joint Health and Safety Committee, where workers and student workers have power. Complaints and issues are directed to the CAO's office, the Chief Administrative Officer's office, or the people under the control of the CAO. And quite often there's little or nothing done about these issues if management thinks the issues aren't important enough or would be too costly to do anything about. Students, faculty, and staff routinely take a back seat to the decision-making powers of bureaucratic, administrative, managerial staff, when many of these people have little to no experience understanding, understanding, or training in the fields of environmental, occupational, or personal health and safety. OISE graduate assistants also work very closely with their supervisors, and therefore there is a unique dual academic and employment role that these managers play. It's less straightforward for student workers than, say, a shop floor at an auto plant with workers on the assembly line and managers chomping cigars in the boardroom. This fuzziness is leveraged by management at OISE and U of T to make student workers feel like they can't complain, that they're not entitled to the same health and safety rights as other workers, when the law, the Occupational Health and Safety Act, says otherwise.
Next, I'll talk a little bit about workload management, which I'm sure that this has been something that we've had to make a lot of shifts in. Now, according to the Articles 13 and 15 in our collective agreement, our expected hours are generally 120 hours per term. When you average it out, it's approximately 10 hours per week. And it has been said that it's quite important to make sure you keep track of your work hours so that you're not doing over or under, and that you're also able to have an idea of roughly how many hours you are working every week. Now, in our article also in 17, section 9, we get 2 to 4 paid sick leave days, which I think that most of us don't know. And this can be a challenge if you have, let's say, days where you're just not able to show up, but also the fact that each position as a GA is quite different in how the hours are expected to be fulfilled when you have to complete tasks. So do keep that in mind. Now, another thing about the concerns is the productivity and the routines. Back when we were able to go into the OISE building, when we had meetings, we were able to schedule our meetings and have a break in between and so on. There was a little bit of buffer time, and that gave everybody a bit of a break. Unfortunately, now what we are finding is that a lot of our members are scheduling meetings back to back because we are already in front of the laptop, which is our office space. And so that makes it that from one meeting to the next, we don't really get the break. And that really has a strong impact on how we are able to be productive and the quality of our work will also be impacted by that too. So these are some things to think about. And also, even the kind of work that you are doing when you're constantly sitting in front of the laptop or your computer, what is it that you have to do? What are some things that will allow for you to actually take a break and remove yourself from that office space so that you're able to, let's say, something as simple as have your lunch? Where are the times for that, right? So that routine has been greatly influenced, and not everybody is able to be able to have their own structure now, because this is sometimes reliant upon the scheduling of what your supervisor expects you to do and also the tasks at hand. And the next concern that we have been thinking about is the isolation and loneliness that a lot of our members have to experience because they're not able to interact as much with other people. Most of us are working from home. Now that restrictions are slowly lifting, there are also opportunities to work at cafes, outdoor working spaces, and so on. But as you can see, with the limited amount of people that are allowed into the OISE building and into the offices, we aren't working at OISE. And also a lot of the concerns with health and safety that Justin and Atika have highlighted earlier, it probably isn't the best idea to be working at the OISE building at this time. So concerns about not interacting with your colleagues, not really getting, again, that break that we've talked about. There's also the mental health strains that can come with working in one space all the time and really not allowing yourself to be able to leave that space when you need to. The relationship challenges that you can encounter. A lot of our members are living with family members. They might be living with housemates, friends, and so on. And that can put a strain because you're constantly in the same space as other people and not necessarily a space that's going to afford you the opportunity to kind of do the things that you need to do for your work and still be able to have the time off from the people that you're seeing all the time because you also live with them. So those are things that we are very much concerned about. And also on top of that, sedentary behavior, right? Like, again, not having a change of scenery, that can also not only have a mental impact on us, but also a physical impact, which Deanna will talk a little bit more about next.
Yes, so I'm going to be talking about some of the physical impacts of the sedentary nature of the work that we do as graduate academic workers. And so I'm going to be focusing on ergonomics, and that's one of the aspects of our work, particularly now that it's being done remotely, even though for many GAs, for many of us, working from home was not necessarily uncommon prior to the pandemic. And on the right side of the slide, there is a picture of a person slouching over their computer while working, and how many of us can actually identify with that posture while working, whether it's on our papers for courses or doing data analysis for our own projects, or data analysis for the research projects that we work on as GAs. So again, thinking about the impact that academic work actually has on our physical bodies. And so one of the things that Wales mentioned just now in terms of the sedentary lifestyles, right? Like how often are we taking breaks and moving around? And the impact that has. And so one of the impacts on our bodies that poor ergonomics can have has to do, for example, with repetitive strain injuries, which are not that uncommon among academics. And so this can be things like tendonitis. So how many of us have complained about pain on our wrists, pains on our elbows, pain on our lower backs, pain on our neck and shoulders? And these again, which can these sometimes might be temporary, but they can become chronic problems. And so these are also considered to be hazards of the workplace, health and safety hazards of the workplace, and are often associated, as I just mentioned, with demands of work. And so includes, for example, sitting at our desks for a really long time and holding the same position. They can also be caused by repetitive movement. So typing, writing is a big part of the work that we do as graduate academic workers, yet that kind of repetitive movement can have an impact on our bodies. So our wrists, so tendonitis of the wrist is not an uncommon ailment of academic workers. And then going back to some of the things that both Wales and Justin mentioned earlier about the factors that contribute to workplace stress, such as the expectations, the workload, and the organizational structure. Those factors can contribute or, depending on how the workplace is organized, mitigate towards tension in the body, right? So when we're stressed because of deadlines, because we've been working really hard for a number of days to finish a project prior to a deadline, that will have an impact on the tension that we carry both in our shoulders, in our neck, and then again, can contribute towards things like repetitive strain injuries and other musculoskeletal disorders.
So keeping in mind the strains associated with our studies and GA work, you do have access to several healthcare services to help you manage your health better. So under the University of Toronto graduate student benefits plan, you do have access to mental health care professionals, as well as physiotherapists, chiropractors, acupuncturists, and massage therapists. And you can find information about all of these at studentcare.ca. You also have some more coverage through your position as a GA with the CUPE 3907 top-up benefit plan. And you can access that information on that on the CUPE 3907 website.
The Joint Health and Safety Committee is the action arm of the Occupational Health and Safety Act. JHSCs typically meet quarterly, and its members conduct workplace inspections between these meetings. There must be an equal or greater amount of worker members to management members on each JHSC to ensure that management can't bully and dominate the committee. So JHSCs can only function as intended and in accordance with the Occupational Health and Safety Act when there's a healthy number of workers participating on them. All workplaces with over 5 workers must have a functioning JHSC. Workplaces like ours with 50+ members must have a robust committee with at least 4 members, and quite often workplaces with multiple unions and working groups such as ours will have multiple members from each union and working group at that table. The main directive of the worker members on the JHSC is to make recommendations to the employer at the JHSC and in between meetings regarding any workplace health and safety concerns that they have. This could mean making a recommendation for the employer to take some form of corrective action to fix a hazard or to conduct specific testing like air quality or asbestos testing, etc. Or it can be to recommend changes to the functioning and transparency of how the committee itself operates. After recommendations are made by the worker members of the Joint Health and Safety Committees, the employer then has 21 days under the Act to respond and or take corrective actions to these recommendations by reporting directly back to the worker members of the committee. Furthermore, it typically isn't too onerous for workers to participate on the JHSCs because the meetings are held, like I said, quarterly, and most of the work in between involves occasional work site inspections wherein a team of workers and management members on the committee inspect each area of the workplace and document hazards or potential hazards that they find. So at OISE, we do this floor by floor. They then compile this information into a report with suggested corrective actions, which then must also be responded by management within 21 days. The scope of what the JHSC committees can do and what the workers on them can investigate and recommend to the employer is really based on the participation levels of the worker members. If there's only a few on the committee, then it will probably struggle to ensure basic discussion and inspections are happening. If there's a robust committee with lots of active worker members, then the scope of the JHSC can be expanded to include hazards that are grossly underlooked, like mental and emotional health hazards that many workers face every day. Management always defaults to doing the bare minimum, and quite often not even that. So the JHSC is only as strong as its worker members. We need more OISE graduate assistants on the OISE JHSC. Contact us as soon as possible if you want to step up in this regard. Please also sign the petition calling for a safe University of Toronto reopening that has most of the campus groups that I mentioned at the very top of this presentation supporting emphatically. I believe currently there's over 800 signatures.
If you have any questions, you can reach us or contact us at CUPE3907@gmail.com, and we will be able to respond back to you as soon as possible. We also, in addition, have a resource. The link will be added on later, but it is a video in the next slide. So we also have an additional resource, which is it safe to return to the campus, which will give you more information about some of the concerns that have been highlighted.